Everybody, my name is Colin. I'm gonna be your nurse today. Can you tell me your name and date of birth?
Luke, 0502-2000.
Let me see your armband. Alright. I've done hand hygiene and provided privacy. General inspection, he's making eye contact with me. Facial features are good. He told me his name, date of birth, stuff like that. I can tell he's alert and oriented. Looks like he's not in any distress. Good grooming. He doesn't look emaciated or anything like that. He can obviously hear me. He talked back. He's looking at me good. Skin, like warm. There's no, it's not cold. It's got good color, good pigment. Hair and scalp, shiny. There's no flakiness in the scalp or anything like that. You can tell he's got good grooming at home, good home life, mental state as well. He knows how to take care of himself. So skin turgor, you'd want to test for like elasticity of the skin up here below the collarbone. It obviously goes down immediately. Skin breakdown, 3 factors of like skin breakdown would be like sitting in the sun too long, tan in bed, too much moisture, sitting down for long periods of time, stuff like that. Any dry flakiness, skin, anything like that. We'll do nails next. No clubbing, got good capillary refill. Clubbing would be a sign of low oxygenation. They're clean, they're not dirty. There's no other signs of abnormalities. Head and face, symmetrical. It's not drooping on one side. Any headaches lately, anything like that?
Nah.
Ears, symmetrical on both sides. No drainage like that, anything like that. Your hair okay?
Mm-hmm.
Okay. Do you have a pen? Eyes, any trouble seeing anything? Ooh. All right, so we're doing pupillary response. Let's look straight ahead for me. Look straight. Good pupillary response. All right, I need you to look at that back wall. When I tell you to, look at the tip of this pen. It's about 6 inches away from his face. Okay. Good deal. Pupils changed. Nose. Cover one side and breathe, and do the same thing on the other side. All right. Any drainage?
No.
Problem smelling, anything like that?
No.
Let me see your mouth. Open up wide. Good color. It's moist. And look up for me. Trachea is midline. Look to your right or left. Sorry. JVD. He's got no signs of JVD. Look to the other side. Same thing on the other side. Any stiffness in your neck, trouble swallowing? Swallow for me. Okay. So I've already assessed his level of consciousness and orientation. He's speaking to me, he knows where he is, he can tell me what's going on. Glasgow Coma Scale, it is eye response, motor response, and he's looking at me, he's talking to me, so that looks good. Any trouble with memory, any trouble with thoughts or anything like that? No? Okay. All right, now we're gonna move into respiratory. We're gonna do respiratory rate. So, All right, respirations are about 14. They're non-labored. Eupnea, as you would describe it. I'm gonna listen to your lungs, buddy. Okay.
All right.
So we got right upper lobe, left upper, left lower, right lower. Put your left arm across your chest, or right arm, sorry. Deep breath. Right lateral lobe, and then do the same thing on the other side. Left lateral lobe, and then we're going to do posterior. So left upper, right upper, right lower, left lower. Good deal. I don't hear any adventitious sounds. Make sure you turn if you're bedbound, I guess. Turn, cough, and deep breathe. You want to turn on your side, take a deep breath, a cough. Do that like while you're watching TV, during commercial breaks, stuff like that. And send a spirometer, blow into that about 10 times an hour. And then any shortness of breath, anything like that, good deal. I'm gonna listen to your heart sounds. So we've got aortic, pulmonic, Herb's point, mitral, and tricuspid. And then I would use the bell of the stethoscope to look for any type of murmur or S3, S4 sounds. And we're gonna do pulses. See your right radial pulse. Regular rhythm, I'll give about a 2+. See your left. Again, regular rhythm, 2+. Now we're gonna do posterior tib. Give that a 2+, still regular rhythm. And then dorsalis pedis is on top of the foot. We'll give that a 2+ as well, still regular. And I would do that on the left side as well. Pulses would be carotid, up here in the neck, axillaries in the armpit, brachials right here at the elbow. We've already assessed radial. Femoral would be in the groin, and then you have your popliteal pulse right behind your knee. And then we shall check for edema, any swelling. And then we'll do lower extremities, no swelling, anything like that. Okay. Let's see. We've already assessed capillary refill. And then any leg pain recently? No leg pain. Feels like your heart racing, anything like that?
No.
Nothing like that. All right, we'll move on to GI. So normally a patient would be laying in bed about a 30-degree angle, and I would lift their shirt up and inspect their skin, check for, I guess, on males, even hair growth, nothing, no redness, no patchiness, anything like that. And then listen to your bowel sounds. So we've got right lower quadrant, right upper, left upper, and then left lower, palpate. Doing the same pattern. Any tenderness? Any belly pain lately? No? Cool deal. When was your last bowel movement?
Yesterday.
Any trouble passing gas, anything like that? Alright. Now, we're gonna do musculoskeletal. So we're gonna do 2 upper extremity range motions and then 2 lower. So we're gonna do shoulder. We're gonna do flexion and extension, and then abduction, adduction, and then circumduction, stuff like that. And then we'll do the elbow. You can extend his elbow and flex, and there's no hyperextension there as well. And then we'll do knee. Knee extension, knee flexion, and then we'll do ankle. So we'll do plantar flexion and dorsiflexion. All right, now I need you to get up and walk to the door for me. Set some gait and balance. Good gait, good balance. Now, close your eyes. We're doing the Romberg test. No swaying. Good deal. Any trouble peeing, anything like that?
No.
No muscle aches, no muscle cramps, anything like that?
No.
Okay.